We are in the age of the old. Let's celebrate. Life expectancy in Europe has risen by an average of 10 years since 1960. By 2050, life expectancy in Europe will have risen from 72 years today to 82 years. However, every silver lining has its cloud. Extra years of lifespan will not necessarily be as enjoyable as they could be. Chronic illness threatens the advanced years of many Europeans. Did you know 100 million Europeans have a chronic disease? Which means the viability and sustainability of European countries' healthcare systems are under severe strain. Why? Because our healthcare systems were designed to respond to acute, short-term illnesses and injuries. Rather than prevent and manage the gradual long-term impact of chronic conditions. Between 70 to 80% of European healthcare budgets are spent on chronic care. That's a staggering 700 billion euros in the EU. So what's to be done to ensure the increased longevity is an opportunity rather than a problem? Research indicates that much of the chronic disease burden can be prevented or substantially delayed via effective secondary prevention. Early diagnosis and early intervention to treat disease in the early stages. Look at hepatitis C. There is no vaccine for HCV. And the majority of individuals with HCV have no symptoms. Approximately 60% to 70% of people with HCV develop chronic liver disease. 5% to 20% develop cirrhosis, and 1 to 5% of patients will die from the consequences of chronic infection. But the sooner you start treating HCV, the better the outcome. And what about tertiary prevention? Reducing the negative impact of disease that has been diagnosed and reducing disease-related complications. Improving secondary and tertiary prevention can help reduce the burden of chronic conditions. It's never too early to tackle chronic disease. Healthy practices can start in infancy, or even earlier in utero to help forestall the onset of disease. And this requires us to retool our thinking. Because whilst funds continue to be directed in the way they always have, on hospital-bound patients, treating disease once it occurs, there's a problem. Chronic disease accounts for over 86% of deaths in the EU. But only 3% of current health expenditure in Europe goes towards prevention and public health programs. So what should we be doing? How should we be investing? Where should we be directing resources to deliver a healthcare system that's sustainable? Our challenge today is to find new recipes for sustainable healthcare.